Good evening, guys. I'm Jay, Karen, Juan. I'll say good morning. Good evening. Good evening. Mary, how are you? Jared, how's it going? Jumbo, Corey, Gary, everybody. And Jay.
Thank you.
All right, can you guys think back to 1995, or like late December 1995? I'm assuming, I think you guys are probably opening your presents that time, waiting for the Christmas tree, you know, with the whole Christmas cookies and the whole package. You're thinking to yourself, okay, today's a good day. Fortunately for me, on that very morning at 6 a.m., I realized there was shouting in my house, a door being knocked down, and calling of 911. I thought at the time of being 5 years old, I had no clue what was happening at that time. I was thinking maybe I was dreaming or something. Fortunately, it wasn't a dream. I realized my ambulance that came to my house, and I saw my grandma laying motionlessly on the floor. At that time, I sort of wonder what caused this to happen for her to lay on the floor lifelessly. Later, I would start to realize that it was caused by a brain attack. So for this speech, I realized I want to put forth the information and the research to determine what caused it and what are the effects. So today, I'm going to be talking about strokes, the natures of it, the symptoms, not the symptoms, the people who are affected, and if there's any treatment for it. Okay. So we'll start off by talking about the natures of it. Okay, so a stroke occurs in two ways. One being a ischemic stroke, which also means blood clots or plaque buildup within the tight arteries that comes from either the heart or any other living organ in the body. Second stroke is going to be a hemorrhagic, you can say that. What it means is that how can I say it, bleeding of the surrounding tissues. With that being said, anything that's bleeding, of course, is going to cause the living organ to die. And like all our other organs, it requires oxygen and nutrients to help keep it alive. And without it, of course, it's just going to go away. Your body function is not going to work at all. So when I was doing some research, I checked out, according to Jeff's Stroke Center, the Acute Stroke Center, I'm sorry, it says about approximately 795,000 Americans are affected by either new or recurrent strokes within a year. And when we're looking at that statistic, we're not thinking about the other side of the world, like such as Asia and Europe. We're not counting that. That's only in the U.S. In addition, Jefferson's Acute Stroke Center, stated that within every day, approximately 40 seconds, let's say, there's a stroke happening, either a new one or a recurrent one happening. Like other diseases, numerous symptoms goes with it. The best way to tell by it is normally you would see half of the part of the body, you would see, how can I say this, it would either be numb or weak. For example, if you would ask a person to speak and you would hear slurred speeches, that could be a sign right there. Another sign being, for example, less movement of the arm or the leg. That can also be another symptom of it. And if you want to check to see if they, I guess, are developing it, you're going to ask them to walk. if they do walk, and of course, if you see like a drunk person, for example, they would slink to the side, something like that, right? But that's the best way to tell. If they don't walk in a straight line, or if they lose their balance, that's a sign of saying that maybe a stroke is about to happen. So another thing that happens with a stroke, it's called a mini stroke, also known as a TIA, also known as transition ischemic attack. So that's what it means. It basically means a mini stroke is occurring. It could go on for minutes. It can go on for hours. Normally, it will probably last up to 3 hours within that day period. If it does occur, you will want to call 911 and get medical attention as soon as possible. The way doctors can figure out if there is going to be a stroke, they would order a CT scan of the brain. They would determine to see if there's any blood clots or any hemorrhage or any bleeding within the brain. Since those two are completely different stroke attacks, they will want to give the proper medication for it. Okay, so now that we have talked about the natures of strokes, let's talk about the people who are affected. So stroke being a really deadly disease, it accounts for being at the third major cause of death, followed by cancer and heart disease, as stated in the American Stroke Association. The American Stroke Association also said in the year 2009, how can I say this? It cost hospitals approximately $68.9 billion for that year, and I don't have a current date for 2010 or even 2011, but chances are it's probably rising higher due to the age. So some symptoms would be high blood pressure, cholesterol, diabetes, and even smoking. With low blood pressure, if you have low blood pressure, it reduces blood flow to the brain, and when you have low blood flow, how can I say this? It's gonna cause a blood clot, and not really good. High blood pressure, if it's uncontrollable, it can be, how can I say this? It's gonna leave a permanent damage for the long run, because that's gonna cause a hemorrhage. Hemorrhage. That's the one. It's gonna cause a hemorrhage attack eventually. Mainly, women are at risk more than men due to the fact that women are at risk more than men due to the fact that they say that women, some of their organs are, I guess, less performable compared to men. That's stated in the American Stroke Association. I haven't really got full detail about it, but they say like women are way different compared to men. Smoking. It's going to be, how can I say it, 4 times more than the non-smoker. The causes are actually stronger. Secondhand smokers are even double that, so it's like 8 times higher chance of getting a stroke. And according to the American Stroke Association, it says with smoking, it reduces good cholesterol. It can raise your blood pressure by approximately 20 points. So if your average is like about 120, you're probably going to see 140 if you continue to smoke. If you have normal 110, it's probably going to go to pre-hypertension or hypertension stage number 2 if it gets higher than 140. So after hearing, I guess, the symptoms of it, or the people who are affected, I'm pretty sure you guys want to know what the treatments are in order to help prevent it. First, we're going to start by saying that there are medications that can help it, to help prevent stroke. First being antiplatelets or anticoagulants. They can help slow down the blood clots and, I guess, help the ease of flow in order for the blood to run smoothly. Another good one is called TIA, also known as, TPA, also known as tissue plasminogen activator, also known as a clot buster. It frees up the, I guess, this is administered through infusion, also known as an IV, going through the arm. It's only done at a hospital, and if done properly, it can help reduce, how can I say it? It can help reduce, it helps prevent the stroke from happening, because it's like a medicine that works over time and takes, what was it, he told me, I cannot remember how long, but maybe like days or maybe a week. Number one is surgery, also known as craniectomy, which is surgery to the brain. They can remove blood clots, they can move, I guess, bleeding that has been, let's say, froze or stuck there or frozen there. It's a really risky procedure, but it sort of does work. But with all operations, surgeries, 50-50 chance that you're going to live or die. This is an open surgery. Okay, so in conclusion, after hearing about strokes and the people who are affected by it, it's kind of hard to tell if there's ever going to be any cure for it. For it affecting millions and even thousands of Americans and people around the world. We're thinking we depend on technology and scientists to maybe help form another cure and hopefully find one day. And I guess that's it.
Thank you, Bunna. It's difficult to sit through so many speeches, isn't it, for all of us? Very difficult.
We've got paperwork.
Yes, what was the time?
12 minutes.
12 minutes. So what we have is this. For time, we have a 4. For tape, we have a 5. For paperwork, we have a 4.